what obesity medications are available? There are several obesity medications that are available. Probably the oldest medications that we've used in our office are medicines like Phentermine, which is an amphetamine-like medication, but it's not an amphetamine, and side effects are similar to too much caffeine. In the state of Ohio, there's a lot of regulations regarding Phentermine. It is a controlled substance, and so controlled substances are controlled because they can become habit-forming. But it's probably one of the least expensive anti-obesity medications. Then there's a medicine called Qsymia that has Phentermine and topiramate in it. So with those, they work very well together. They help control hunger. They can be used long-term, and we've seen great results with those. However, they can also be teratogenic. And so anyone who's on Qsymia or Phentermine topiramate, we recommend typically 2 forms of birth control because it can become teratogenic. Then you have a medicine like Contrave, which is bupropion and naltrexone. And bupropion is the medicine that's in Wellbutrin. It's an antidepressant. It's also the medicine that was in Zyban to help people stop smoking because it deals with some of the emotional pleasure with eating and the cravings. And so it does a phenomenal job with that. And then it has naltrexone, which helps augment that effect. So you're eating to live, not living to eat, so to speak. After we used Contrave, then there were some other ones like Meridia was pulled off the market for safety reasons. But then we really jump into the GLP-1s, which are a whole new line of medications. And those are your glycogen-like peptides, your semaglutide, your tirzepatide, your liraglutides, and those are typically your injections that work phenomenally with decreasing hunger, slowing down motility of the digestive tract, lowering blood sugar, but they're also the most expensive medications. But they are probably the ones that we've seen the best results of out of all the anti-obesity medications. There's another anti-obesity medicine called Orlistat, or the brand name of that is Xenical, or there was an over-the-counter version called Ally. And that one was a fat blocker, where if you ate too much fat, your body told you about it. And I liked that one because I thought it was an educational drug. You know, it's going to give you feedback on what you did. I had a patient once who went out, and I think she had like 3 bratwursts or something, and she had Orlistat, and her body told her about it. She goes, I never realized bratwurst had that much fat. So it was very informative because her body had side effects that let her know she had consumed too much fat, but ultimately now she understands what too much fat is and was able to make better food choices. So those are pretty much the main anti-obesity medications that I use. There's other medicines similar to Phentermine, which I do not use, but as far as in our office, those are the main ones that we use.